Hi guys, thank you for joining me. Welcome. Over the past week, I have been receiving a lot of feedback from you guys, and I thank you for that because it really helps me to understand what it is that you would like me to discuss going forward. And you've also mentioned how much this is helping you to explain to your family members what lupus is and all of the issues you struggle with. And many of you have come back with some positive feedback saying that your family members are much more understanding, much more helpful, and they have some sort of an idea as to what you are facing on a daily basis. So today we are going to discuss what is a lupus flare. Now, whether you have lupus or someone you know has lupus or systemic lupus erythematosus, you may have heard them say that they are having a lupus flare. It is often said that lupus is an individualized disease, and this is where the individuality of lupus comes in. Lupus patients experience similar symptoms, but in different ways. They are the same symptoms that are prevalent during a flare-up, like severe, intense, persisting joint pains, skin rashes, unexplainable fatigue. There are also triggers for lupus flares, such as stress. Now, stress is the biggest factor, the biggest contributing factor, and you and I both know that that is really difficult to deal with. And people are dealing with emotional stress, physical stress, mental stress. There's also extreme fatigue, infections, pregnancy, hormonal shifts, and sunlight. I am currently experiencing a mild flare since last week due to the sunlight. I am struggling with severe joint pains, fatigue, a mild low-grade fever. Whenever I am exposed to the sunlight, I end up feeling completely drained out, and I can also end up with red rashes on my skin, on my scalp, because the sun tends to burn through my clothing. Even though I use SPF, it really doesn't help. So some flares are silent. A patient can feel extremely weak, and this flare-up can depend on blood tests, imaging studies, and urine tests. You can sometimes be having a flare-up and not even know it. Please bear in mind that a lupus flare is not your fault. I remember every time I ended up with a severe flare, I would lie in the hospital bed and try to trace my actions to make sense of how I ended up so sick. If it's something that I caused, if it's something that I contributed to. And I just want to let you know it happens. And sometimes it is not even what you have done or what you haven't done. There is just simply no explanation for how this happens. Flares increase inflammation that leads to symptoms. If you had distinct symptoms when you were initially diagnosed, for example, I experienced severe joint pains, fatigue, and low-grade fever. So whenever I have a flare-up of lupus, I end up having the same sort of symptoms. And so when I flare up, my subsequent flares are most likely to present the exact same way. So I have the same symptoms. Sometimes I will have new symptoms like mouth lesions or red erythematous patches on my scalp. And however, new symptoms can show up in different ways as well. Sometimes you don't even realize or recognize what they are. It can range from mild to severe, can last for days or weeks. A mild flare can be managed at home. Severe flares is going to involve organs and joints that are inflamed and might lead to permanent damage. Flares require immediate attention. You might need to go to the ER as well as require hospitalization at times for further tests and investigations. This is not uncommon. Recurrent flare-ups can cause a particular organ that's affected repeatedly to be exposed to a lot of inflammation. And when the organ heals after treatment, that organ is left scarred. The medical term for this type of scarring is called fibrosis. When a particular organ has been affected, it is impaired and cannot function adequately. This is in a worst case scenario. I also want to mention that even though scarring occurs, the body is resilient and can repair itself. It has the ability to heal itself and restore its function. When I have a flare, these are some of the ways I try to manage the flare. I am not only a nurse, but I'm also an individual living with lupus. I try to reach out to my rheumatologist if she's available. If she is unavailable, I try to see my family practitioner and ask her to email my results and her findings to my rheumatologist, just so that we can have a paper trail to keep communication open for the period that I have not seen her until I see her again. So we can actually assess the number of flares I've had in between. And if you are having recurrent flaring, it means that the treatment you're on is not adequate. Maybe something needs to be added or taken away, and your doctor will decide on that. I rest, I take naps. This is difficult for me to do as I am a busybody, but in this case, I don't have a choice because lupus knocks me out. I listen to my body on these days and I rest. I take Panados and Cyanoleaves as I am not allowed prednisone or anti-inflammatories because of my kidneys. So you must take the medication that your doctor has prescribed. Ask for help from family and friends, and this is also hard for me to do, but when I am having a flare-up, I do ask for help. It's taken me a while to resort to that, but I have come to understand that there are people that do want to help, so please make use of them and their kindness, their generosity. And I try to keep my mind busy with productive thoughts and not focus too much on the pain and what's wrong. I also try to ease my stress levels, minimize my stress levels by doing what I can and postponing the things that can be postponed. During a flare, don't think about it too much. Just try to survive it. I try to find gratitude even in this tough time. I try to be consistent in whatever I'm committed to doing, like this channel. I can show up and help someone who is having a bad day, like I am having a bad day today. And this helps me to live beyond lupus. This is what a lupus flare looks like. Exactly like what I look like today. I could go out or I could meet somebody and they would never be able to tell that I am currently having a lupus flare. It's very much an internal process. If I have a rash, it can be seen, but if I don't, nobody knows what I am facing. It is an invisible disease, as we mentioned many times before. So you can't see it, but I can feel it. I hope this has helped someone today. And remember that all of the views that I share on this platform, all of the advice I've given you is because I'm experienced as a lupus warrior for about 8 years now. And I'm just sharing with you how I try to maneuver my way around life with lupus. So don't replace this information with any of the information and the treatment regimes given to you by your doctor. Make sure you check with your doctor first before you make any changements or adjustments to your treatment. Hey guys, please share, subscribe, like this video, and until next time, remember, the show must go on. Keep the faith. If you want a copy of my book, The Show Must Go On, I've mentioned to you that it is on my website, www.theshowmustgoonbook.co.za. Love you guys. Bye.